Hi, my name is Jo Walters. I'm an infection prevention and control nurse. Today I'd like to demonstrate a suitable technique that can be used in areas where patients do not spend an awful lot of time in that unit, and perhaps there may be more than one patient in that bed during the day. Ordinarily, the bed should be decontaminated at least once a week by thoroughly dismantling it, which is demonstrated in an alternative video. Here we're just going to show the shorter version that can be employed in areas where, as I say, patients only spend a short period of time. Before you start the procedure, it's important to ensure that you have all the correct equipment with you and also the correct personal protective equipment. You should wash your hands before you do apply your personal protective equipment. The full process of this is demonstrated in another video. In order to clean and disinfect a bed appropriately, it's important that you first physically clean the bed. To do this, you need a neutral detergent, or alternatively, you can use combined products, which is a one-step process. These are combined products, but please refer to the manufacturer's instructions and also to your local policy to ensure that you are complying with the correct dilution strengths and also the correct application time. In order to access the important areas, it is necessary to dismantle some parts of the bed, and we shall demonstrate how to do this now. If you have any concerns over your ability to be able to perform this task, then I suggest you contact your manual handling advisor for further advice. Before you start to clean the bed, it is important to raise the bed to a safe working height. Disconnect from the main supply. And you will still need to remove certain elements of the bed. You will need to dismantle the end plate and the head plate. You can place these onto the floor safely, ensuring that you maintain a neutral position and have a steady base. We will clean those plates before we put them back onto the bed. Whilst the majority of this cleaning process could be a one-person technique, you may need the assistance of a second member of staff to safely manoeuvre some of the items, such as the mattress. Ready, steady, turn. We now have access to a vast majority of the surface area, allowing you to make a visual inspection to see if there's any contamination. If you do find any gross contamination on the bed, you will need to fully dismantle all the bed properly. Raise the backrest to allow you to visualise the underneath of the base plates. As there is no visible contamination, we can now continue to just clean the surface. Okay, clean the surface of the cot sides where the mattress may come into contact with when you next manoeuvre it, but we will thoroughly decontaminate the cot sides towards the end of the process. We now need to clean the surface area of the mattress, which is going to come into contact with the already cleaned part of the bed. Okay. Once you've cleaned all the edges of the mattress and it has had enough time to dry, you can flip and rotate the mattress to allow you access to the rest of the bed. Ready, steady, flip. Raise the foot of the bed now in order for you to make a good visual inspection underneath the plates and the frame of the bed. It's now important to thoroughly decontaminate the cot sides, as these become very easily and heavily contaminated in between patient uses. We will also need to pay particular attention to the handsets, the nurses and the patient, because they become quite easily contaminated also. These parts of the bed become very easily contaminated, so it's very important to make a visual inspection and ensure that they are physically clean between each patient use. Clean the underside of the plates that are going to come into contact with the bed that you've just made nice and clean. And then once you've put them back in place, you can clean the back and the front of them. And finally, ensuring that the handsets are thoroughly cleaned. You'll also need to ensure that the lead is clean, the mains lead, but be careful to ensure that the contact points are thoroughly dry before you put them back into the main supply. Finish cleaning the bed, you need to remove your personal protective equipment, dispose of into the clinical waste, and thoroughly wash your hands. In order to show that the bed has been thoroughly decontaminated on discharge of the patient and is ready for the next patient to use it, you should apply a piece of indicator tape, dated and timed and signed to show when the process was undertaken.